Hello, everyone. This is Bobby Ghoshal, President and COO of Experity. I'm here with Tanvi Patel, GM and VP of Amazon Pharmacy. Really excited to be here by way of a very short introduction. New to Experity, but not new to healthcare and health tech. The last 13 years, I've been part of a very large global healthcare company and built a SaaS software platform, multiple EMRs. We call it out of hospital system. And there was thousands of providers, millions of patients. Same issue around patient experience, which was so important, especially out of hospital where, there's a fragmentation of the systems, etc. But we are here today to hear your thoughts, Tanvi, on what this means.
Yeah. Really excited to have you here and excited about what we're talking about. Everything you just described is why I think our companies have come together to build an experience that helps address where the patient journey is failing our patients in this country today. So I'm excited about what you have built in your past roles and what we're doing together at Experity and with Amazon Pharmacy today.
So speaking of why we are here today, the collaboration that Experity and Amazon Pharmacy have on the table here is a milestone event, I feel. And not just for our Experity, but for the future of on-demand healthcare.
Yes.
So patients now have the option of selecting same-day pharmacy, Amazon Pharmacy, as they come out of the urgent care visit. Yeah. That's a tremendously powerful, impactful part of the patient journey. Do you have any thoughts on how the patient journey would be impacted by what we are discussing here?
Absolutely. What you just said in terms of on demand, it just makes sense. If someone is going in for an urgent care visit or if they're going in because they need to see a physician, there is more than likely a medication that they might need to take to get better. And in those cases, that needs to be delivered urgently. And so when we bring together the investments that Amazon is making in pharmacy delivery, where by the end of this year, we'll be able to deliver to half of Americans in less than 24 hours, and that can mean in hours for many folks, or the delivery via kiosk that we announced a couple of weeks ago that will expand to more and more locations. When folks need that medication fast, if they can get that medication quickly after that visit, they're more likely to take it. One thing we know is 1 in 3 Americans don't pick up their medication. And that means that med adherence is down. And that means that they have poorer health outcomes. So together, I think this collaboration is really going to help us just improve overall health outcomes with combining urgent care in general, care delivery with urgent delivery of medications.
Absolutely. And you mentioned the abandonment rate.
Right.
And apparently there's a 2% abandonment rate for a same-day prescription pickup. Guess what it is for if you don't pick it up the same day? It's an order of magnitude higher, 20%.
I believe it.
Or higher.
I believe it.
Which is really the problem we're trying to solve here.
Yes.
Medication adherence is really important to the patient experience,
Absolutely.
The patient journey. And so this is a hard problem, and we hope that this will be solved significantly.
Absolutely.
With the solution that we are talking about. And access itself is such a big issue. We think about 15% of all calls that come back to urgent care is around prescription.
Oh.
And for providers, this is a big part of the patient experience and patient access. And so improving the on-time, same-day medication pickup will hopefully help in this provider experience area too.
Completely. And what you were talking about before is we can address all of these issues through tech and by being patient, customer, and even provider obsessed. At the end of the day, their time is so valuable. And so the more that we can ensure that providers aren't getting a call because the patient couldn't afford the medication and they didn't know how much it was going to cost before they went to the pharmacy and stood in line for an hour, that they stood in line for an hour and then the medication wasn't available. And to your point, if they didn't get it that day, they're even less likely to take it at all before the next time maybe that condition flares up and they see themselves in an emergency room. And that's what we're trying to prevent is those hospital administrations, which is really bringing down the cost of healthcare in the country. So if we can start to be more preventative and more timely about care access and medication access, I think we're just going to see overall health improvement when we bring it together with transparency, access, and availability.
Absolutely. Just from my own experience, I was in the urgent care. I broke an ankle. Yeah, it's grizzly. You should see the grizzly. And I got the prescription. I did not have time to pick it up that same day. Next day, I was traveling. And guess what? I did
Didn't
not
go.
pick up my
Of course.
medication
Of course.
at the time. That's just from my
Right.
experience with all the access that we have.
Yeah.
And if you think about Gen Z, for example, 60% of their healthcare experience is through urgent care, through on-demand care. And what does Gen Z want? They want things delivered at their
Yes.
doorstep. And so
Yeah.
we believe that this is a significant step to improving their patient experience.
Absolutely.
And what do you think?
Absolutely. I have my own personal experiences the same. I have small children at home. When there was a morning, I found myself with pink eye, and I did not want to go infect anybody else. I did a visit with an urgent care center that was a telehealth, and they gave me the prescription for an antibiotic, and I could stay home. The antibiotic was delivered in hours, and I could start doing my eye drops, whereas it was a working day. I would have not had the time to stop by and stand in line and get that prescription. It would have gotten a lot worse. And I don't know who I would have infected on the way, having to be out and about with an infection. And I think that many people have this type of story where they're not getting the medications. And to your point, we get busy. We have travel. We don't know when we're going to take the medication. I think one of the things you said about just the Gen Z and how they're perceiving care is also very important in terms of folks go in to see a doctor for maybe a condition, a broken ankle or a pink eye on the day of, but something else could surface. And I know for myself, even for the longest time, I didn't think that taking the recurring medications were important, not until someone really explained to me. But it really hit home when it just arrives at my doorstep and I don't have to think about it. And now I'm so consistent with medications. And I think that's the story for so many people.
Absolutely. And with the scale that we have at Experity, we see 30 million prescriptions a year. And if that's the story, Tanvi, that you have and I have personally felt, imagine the impact we can have on those 30 million prescriptions annually. And that can be such a better experience, hopefully even improve the outcomes of healthcare.
And to your point, too, with the access that we have, with the knowledge that we have, with our understanding of the industry, we are still not being adherent. I can't imagine those that are living in pharmacy deserts, those that are working in hourly jobs and cannot take 2 hours of their day to go pick up the medications. And I think that also with this new generation, we're the sandwich generation. We're taking care of our children. We're taking care of our parents. We're not taking care of ourselves. And that's not doing anyone any good. And so we need to improve overall access, transparency, just make it easier.
So this is an exciting collaboration, Tanvi. I'm looking forward to, in a year, come back and see the impact that we've made with access. All the things that we are doing now.
I think it's going to be phenomenal. I also think that we're going to be able to just impact a lot of patients and providers. Those providers that get calls during dinner time because the patient didn't pick up their meds and they need it sent to either another pharmacy or a different medication. We can get upfront with all of that. And it's almost mind-boggling that it's not as transparent as we're going to make it for these patients.
Amazing. Thank you again, Tom.
Thank you so much.